So what I'm going to do today is just to give you some ideas about how the concept of efficiency and how we might improve efficiency in our health systems. But I regret to say, if you're looking for some magic solution to your efficiency problems, I'm afraid you've got the wrong person. First of all, I just wanted to say a few words about what we mean by efficiency. I think everyone has an idea about what efficiency is. It's a ratio of valued outputs to costly inputs. And it's useful to think of inefficiency as being a residual after all other explanations for variation have been taken account of. So inefficiency is almost by definition difficult to measure because it's what's left over. It's the waste that's left over when we've measured everything else. So I'll talk a little bit more about that in a second. The third point I just wanted to make is that there is a big difference between efficiency and expenditure control. Sometimes people confuse the two, but I'm going to talk about efficiency, and by that I mean the ratio of outputs to inputs. So you can improve that ratio in two ways. You can improve the outputs and keep the costs the same, or you can reduce the costs and keep the outputs the same. But those two things might involve completely different strategies. The final point I'd like to make before I start is that when we compare efficiency between hospitals or between physicians or between countries, we often need to adjust for uncontrollable constraints on better attainment. If we believe that that is outside the control of the health system, we need to adjust for the different diets between the two countries. And that will be an issue we come back to quite frequently. Finally, just in conclusion, I wanted to say a few words about promoting efficiency, because this is, I think, really where we've got to now. What are the things that we can do to make our health systems more efficient? So the next 4 slides take 4 levels of the health system and just make some suggestions about approaches to improving efficiency. I'm not going to go through them line by line. I'll just pull out 1 or 2 examples. So the 4 levels are, first of all, at the system level, which is the concern of that OECD study. Then I'll talk about the organisational level, hospitals and so on. Then the practitioner level. And finally, rather an ignored area, but I think very important, the individual patient level. So at the system level, there's all sorts of material. We can. I've produced the policies under 3 headings: better information, better incentives, and better capacity to do things. So on information, all sorts of things we can do. For example, the third one there, we can public report performance. And I think there's increasing evidence that that is stimulating improvements in some of our health systems. And that's a national level function if you want to get the biggest power from doing that, to get comparable data. We can improve incentives. I know that your CANAM is experimenting with primary care incentives on prescribing, for example, which is an experiment that is being looked at with great interest in other countries, and many other incentives we can look at. But incentives are dangerous things, and they can sometimes go wrong, and I've got lots of stories I can tell you about that as well. But of course that shows how powerful they are, because the fact that they go wrong means people are paying attention to them, but they're just paying attention in the wrong way, or the unintended way. And then we can improve capacity. For example, we can improve the capacity of human resources, all sorts of things there. And we can provide information across the health system. At organisational level, we can do similar things, and again, there are numerous possibilities that we can envisage introducing within our hospitals and our other healthcare organisations to, for example, team incentives in the middle there. I would also pick out governance as being a critical thing. Can we get independent boards of governors to hold to account the management of our organisations? And I think we found that was one of the most powerful determinants of our organisational performance, was the quality of the board of governors. And at the practitioner level, lots of things we can be doing there, particularly I think in terms of guidelines and good practice, and huge variations there are between practitioners. So can we persuade our practitioners to adopt best practice? And then at the individual level, can we encourage our citizens to use our health system more efficiently and effectively, for example, with complying better to medical regimes, using gatekeepers. I know you're experimenting with that, adopting healthy lifestyles and so on. Lots of interesting experiments there. But just in conclusion, I just wanted, this is a purely personal view on where I think the biggest gains can be secured. I ought to say that there are some things that need to be in place before even these can take hold. And I just go back, and this is actually something that Dr. Rocher highlighted the last time I gave this talk, which is the quality of the governance is so important. You can do all of these things, but if you're not regulating, checking, auditing, and holding to account, then it doesn't work. You have to have some feedback mechanism to ensure that all of these innovations will have the best effect. So these are in no particular order, but I think the first thing that we're all beginning to recognise is that our health services are not adapting quickly enough to changes in technology and changes in populations. We are really still very hospital-focused. We are not really adopting the potential of new technology yet to the extent that we can. And there appears to be big scope for reconfiguration. It's politically a terribly difficult area. I don't know, I'm sure your system of politics is not as dangerous as ours, but we even have health ministers who say, when they're health ministers, we must close our small, dangerous hospitals and consolidate into larger, safer, better quality, more efficient hospitals. And then the next day, they're standing on the picket line at their local hospital saying, but we must not close my local hospital. And I'm sure you don't get things like that in your So big issues there. I would actually say that the big gains are probably in terms of patient outcomes rather than reduced costs. That's my hunch there. The second point is information. I think our health systems are beginning to secure benefits from better information. It leads to a safer health system, better outcomes, and more efficiency, of course, in terms of reduced repeat testing, reduced need for patients to travel, and so on. Huge potential benefits there. But again, I fear that we in the UK have wasted billions of pounds, billions of euros with a medical record system that is still not working. And when we could have bought free of charge, sorry, you don't buy something free of charge, we could have had free of charge a web-based system from the United States, which was not brilliant, but would have done many of the things we were looking for. Funding mechanisms, funding methods are incredibly powerful. All of our systems are still fixated with paying on the basis of an episode of care, and we need to look beyond that. One way, of course, looking at paying for performance, of course, to improve quality, but also do we bundle care maybe into a year of care for people with chronic conditions rather than just paying for each episode that they have. There are probably huge gains to be had in health-related behaviour in terms of encouraging citizens to reduce risky lifestyle. As an economist, and you're trained as an economist, to respect people's autonomy and to say if they want to do that with full information, then that's their problem. However, unhealthy lifestyle has a big impact on the health system, and it's the rest of the population that pays for a lot of that use. And so I think there is a responsibility of citizens to use the health system responsibly. So I think there is a public benefit argument there. And finally, there's, I think, increasing evidence that competitive forces do stimulate improvements. Again, competition is a very dangerous mechanism. In many ways, your system has had it for a long time. And the question is, can you harness the good bits of competition to produce better outcomes? And can you safeguard against the worst bits of competition?